Our first guest retired June 31st after 40 years practicing medicine in Niagara. Dr. Janice Giesbrecht was Niagara Health's chief oncologist for 10 years, beginning in 2010. She oversaw the cancer care of scores of local patients. Janice, since your retirement, the comments have been coming in about how crucial your help was to so many families during such difficult times.
It's been very overwhelming for me to see those responses, and over the last months to have those conversations with patients and families. Just, even going back many years, people commenting on what had an impact on them. I am truly overwhelmed. And I did pass on the chief of oncology to Dr. Michael Levesque in the end of 2020. So it's been good to see that part of it continue to develop in the program. And I'm going to keep watching, because it's really important that all of those things continue to grow.
There's been generations of families, multiple generations of families, who have needed cancer care in Niagara, and you were there for them over those many, many years.
Well, and it started in 1985, the program. Dr. Brian Findlay started it at the Hotel Dieu at that time, and it was part of their mission to bring cancer care to Niagara. So you really have to credit that organization. And then it became part of Niagara Health, and clinic transferred, and then plans for the new hospital and cancer center. So it's been a continued evolution.
Janice, big turning point in Niagara, 2013, I believe it was, when the Walker Family Cancer Center opened.
We started the program, as I said, in 1985. It had continued to grow, providing more treatments, and more treatments were available than we had had at the beginning. So huge growth in cancer care delivery. But 2013, with opening Walker Family, meant that radiation treatment could also happen in Niagara. So that's brought another element. Prior to that, patients did have to go to Hamilton for the radiation part of their treatment, even though the consultations and their circle of care was in Niagara. So it made a huge difference to people. And I know over my career, there were several episodes where the province was very much challenged to deliver radiation treatment. The capacity needed to increase. So over those years, we even sent patients to Thunder Bay or Sunnybrook or Cleveland or Roswell Park for their radiation treatment when there was a crisis in Ontario. So the focus between about 1998 and 2013, when we opened, there were quite a number of new cancer centers in Ontario built to increase that capacity.
Beyond that, you also saw the evolution of a number of different cancer drugs over the years for specific types of cancer, which were a little more successful than some of the techniques used prior to those.
Sure. And I mean, surgery and radiation and chemotherapy are still part of our cancer treatment armament. But what has really developed actually over many years are first what we call targeted treatments. It started with hormonal treatments for breast cancer and prostate cancer, but also things like Herceptin or trastuzumab for certain types of breast cancer. And these have continued to evolve as we understood more about how cancer cells behaved. But then there's a whole new layer of that with specifically targeted treatments that were developed, like for chronic myeloid leukemia, has really changed that landscape. And now more recently, immunotherapy, which triggers the body's own immune system to attack the cancer cells. And many of these treatments are much more focused in their effects, so can have different or fewer side effects on normal tissue and the patient overall.
Janice, all of what you say there makes me marvel at how much learning you must have had to undertake to stay up with all of these changes.
Well, and that's one of the pleasures of this field is, 5 years from now, you're not doing what you're doing today. And that's a very positive thing. And to be part of developing that, learning about that, things like clinical trials help us to do that in a very safe and measured way. And patients in Niagara have had access to clinical trials to develop these state-of-the-art treatments from the beginning, which is not always well known in our community.
When you look back on your career, do you fondly recall any specific people in your past who you've helped to deal with these situations? Perhaps someone whose life was saved during your treatment, someone whose life maybe was lost?
There are many, many of those. And one of my patients from many years ago, when he heard that I was retiring, phoned and he wanted to speak to me. He wanted to say what an impact that's had the last 20 plus years. And he's got a grandson who's 10, and he's enjoying those aspects of life that he never quite thought he would be able to enjoy. And his treatment was not easy, and even his diagnosis was not easy. So that's one of the successes. But there also was a comment from the sister of a patient who had started on treatment, preventive, or what we call adjuvant type treatment, meant to be curative. And many patients might even never have needed treatment if we knew who truly required that. But she had other health issues, developed complications after her first treatment, and died related to treatment complications. So it was a very difficult thing to work with and to think about. So there have been many tough situations over the years, but ones in which you always hope that you can bring some understanding, some comfort, and even just explanations. And what this sister said was, how much it meant that I sat down with her and went through what might or might not have happened.
You certainly have had an impact on so many people. Dr. Giesbrecht, thank you for joining us today, and good luck in your retirement.